Here we go. Hey, ladies, welcome to another Self-Love Conversations. And tonight we are going to be talking about a topic that is very important, especially for you moms who had children, who are pregnant right now, and you want to know what you're going to be in for, and those who just had a baby and you're wondering what the hell just happened to you. I am sitting here with Dr. Tina Harris, and she is a prenatal or doula and prenatal specialist, right?
So yes, I'm a doula and a pelvic floor physical therapist.
Yes. So she actually helps with making sure that you can guide yourself through the process of pregnancy and dealing with postpartum uh, issues. I don't have any kids, Dr. Harris. That's why I'm very open to hearing because I hear it so much about the things that go on. So
Mm,
I'm excited about it. So thank you so much for being here.
absolutely. Thanks for having me. I'm excited to talk about this.
Yeah. Why did you choose this?
Ooh, deep question. I think I think it honestly kind of chose me.
Hmm.
From a when I was a little girl, I've always been just amazed with pregnancy, pregnant bodies, and just the whole process that our bodies go through without really any super input from us. Like, the baby
Yeah.
grows and, does its thing and then it's ready to be born. And it's just a very beautiful process. I'm the youngest of two older sisters. So I had the privilege of seeing them, going through the pregnancy
Your
stages, had
pregnancies.
their babies, being the babysitter,
Yeah.
And so it was just always really amazing to me. And I just love supporting women in these stages of life because it's such a huge transition. And it can be also a time where there's not as much support as you think there should be or could be. And so many changes, even, doctors and stuff are kind of wary about, well, you're pregnant, so I don't know, you can only do certain things. And
Right.
so just really being able to support women and just having a safe space for them to talk through things and know what is okay. Because I've seen some people that are like, well, I'm pregnant, so I can't do anything. I was like, well, no, there are things that you can do.
Right. And first we're gonna start with the new mom, right? Um, she got pregnant, went through the whole process of her pregnancy, had a wonderful, healthy baby, thank God. And now she's in it where she has this little tiny body that she's dealing with. And now all of a sudden, things are also happening with her, right?
Right.
When we talk about postpartum, what is it? Is it something, and again, I don't have kids, so I'm really just asking from the outside. Is it just something that happens and it just comes up? Is it something chemically that goes on with your body, right? Is it the environment that affects all these things? What exactly is it? And how do you know you in it or going through it?
Okay. So postpartum. So I think a lot of times people say, oh, I've got postpartum. It's kind of like
Right.
a phrase that we hear people say. And that's usually when they're referring to maybe like a mental health issue going on as well. So like postpartum depression, anxiety,
Uh,
rage, psychosis. There's a whole mental health aspect to when they say postpartum, but it's actually a misnomer. Postpartum just means a period after you've given birth. So it's not
oh,
a condition or an illness or something that's going wrong in the body. It's just a time period. And so, like during pregnancy, we say, we go through 3 trimesters. The early postpartum, we call the fourth trimester because there's just a lot of, again, changes going on in the body. It's that first 12 weeks of baby's life, first 12 weeks after having a baby. And that can be considered like that early postpartum phase or the fourth trimester. I
got it.
personally say that postpartum is forever because once you've had a baby, you've always had a baby, right? And so their
Right,
body is
right, right.
always going through changes. You may be years or decades, past giving birth, but it's still a special type of circumstance. And there's still things that your body may be dealing with even 10 years down the line after having had a baby if it was never
Really?
addressed. initially.
Hmm,
Yeah, so
that's
it's a lot of times people with physical therapy, they're like, well, I had a baby, 5 years ago, 20 years ago. Is it too late for me to come in for this thing that I had, like either during pregnancy or something happened during birth or shortly after? And I say, no, it's never too late to come in and to heal your body. And
so.
even
What
though
are some of the things that happen? Is it that okay? Like, is it because of what they do when you're trying to deliver the baby? Like, they do the forceps, they do the pushing. Your pelvis gets out of place. What happens to the body where you need that physical therapy and treatment?
Yes, so it could be any number of things, and it could be things that even were present before the pregnancy in and of itself. So
Hmm.
things could have been, we're living in a life, our bodies are stressed, we're going through things. Sometimes we have
Right.
pains beforehand. Pregnancy in and of itself is a lot of changes, a lot of transitions going in the body. We're gaining weight, we're carrying a whole new person, hormones, there are shifts in the pelvis in itself. Muscles might get tight, muscles might get weak. There's a lot of things, a lot of dynamics that can happen during pregnancy. During the
Hmm.
birth process, again, a lot of different things can happen. Even if it was the most perfect pregnancy, most perfect birth, nothing went wrong, there were no instruments, baby just came on its
Yeah.
own without any issues. Again, the body is still going through these transitions
Yeah.
that sometimes we just need a little assistance in getting back to it, because like you mentioned, like that postpartum, they're taking care of baby, we're taking care of ourselves. If you got other kids, if you've got a partner in the house, if
That's
you got to go
right.
back to work, so again, it's just this constant stressor to the body, additional stressor to the body, and the body can only, handle so
Take
much
for so
until
much.
before we need a little bit of assistance in helping that healing process along. So it doesn't have to be anything major like that goes wrong
Hmm.
completely. If that does happen, definitely pelvic floor physical therapy is definitely warranted. But I say every postpartum body should be assessed and should get post pelvic floor physical therapy,
Okay.
regardless.
So we got a lot of aspects going on.
Mhm.
After the baby, you're dealing with a mental, you're dealing with a physical, and from what, I was taught, the whole mental part is now you have this, again, this new person, and here you are as a new mother, and all of these feelings are coming into play. When we talk about the mental part of what that postpartum look like, because there's so many books out there that says, you know, uh, be okay if you have any feelings about your baby, make sure that you are, you could be safe, have people around you. What is that aspect? Because I think like a lot of the new mothers who are listening, they're trying to figure out how they can go ahead and balance that, even though if they have help, like with their mom or grandma or whoever, like what are some of the things that are okay to feel, and what are some of the things that they should actually, like look out for if they need to go ahead and seek help?
All right. So I always say all your feelings are valid. So whatever feelings that you're feeling, perfectly valid, perfectly um I try not to say the word normal.
Yeah.
Um
Yeah.
but it's okay, right? It's okay for you to
Right.
have whatever feelings that you're having. If you do notice like changes, and this is for partners to be on the lookout too, if you notice changes in behaviors or increasingly sad or depressed, or you can't find joy and things like that, like those signs of depression, then seeking out a mental health provider. That's not
Hmm.
necessarily my scope, so I don't want
Right.
to go ahead and give advice on the
Right.
mental aspects of it, but definitely have people within your circle looking out for you, because when you're in it, you might not even see it, you might not even recognize it, because it can be so overwhelming that even though things might be different, you're just trying to, like the late nights, the lack of sleep, if you're choosing to breastfeed or anything like that, there's a lot that goes into taking care of a baby. So I find that a lot of times new moms, and I'm actually a new mom again myself. My baby's 3 months old. So I
Wow.
remember very
Yeah.
I
Good.
remember.
Congratulations.
Thank
Yeah.
you. It wasn't that long ago. He's sleeping good now, but it wasn't that long ago where,
Yeah.
every hour we're doing this all over again, and it can be very, very taxing.
Hmm.
So that, like, one of the things that I encourage families and individuals to do during pregnancy is to plan for that postpartum season, like especially
Mhm.
those first few weeks, getting a postpartum doula, getting a night nurse,
Yeah,
getting, you know, tagging in the team, the friends, the family, to even just come spend a couple hours with you during the day so that you can catch a nap or go take a walk by yourself, whatever you're needing to do, but make that plan during pregnancy, because a lot of times during pregnancy we're planning just for the birth. Like
right.
everything is focused on, I gotta get, what hospital I'm gonna
Baby,
be
the
at, who's gonna
hospital.
deliver the baby,
Yeah,
all those things. But we also need to also be planning for postpartum as well, because it's coming. Or
yeah,
it's coming.
yeah.
So by having a plan in place, having your village in place is really, really important.
And you, as a doula, what does that mean for those women who are pregnant or want to get pregnant and they're, interested in what a doula does and how they help? What is it that you provide?
There are lots of different kinds of doula. So I got certified as a birth and bereavement doula. So I support
Mhm.
during the pregnancy, preparing for that birth, and can be present during the birth as well, to really just giving you the physical support, the emotional support, resources and information. And my biggest thing is advocacy, helping you
Yeah,
to advocate for yourself, knowing what questions to ask, like really listening to what your providers are saying, and if it makes sense for you, like if it aligns for you, and asking the
hmm
tough questions,
hmm,
and really just ensuring that you're not being bulldozed with, like, we're going to do this, or this is how it's going to be, but making sure that you as the individual, as your family, you are an active participant in this whole process, versus
right.
like a bystander and everything is happening to you.
Right, right. It's like being equipped to know what to ask the provider while you're going through your pregnancy process. And what are
Absolutely.
some of those things that they need to be or should actually know when going to their provider? Because I would think if I go to the doctor and I'm pregnant, whatever the doctor say is probably what's going on because they're the expert, right? Or
Mhm.
supposed to be the expert. But what are some of the things that a woman who is pregnant should look out for
Yeah, and
or
that's one of
ask?
the I hear that a lot, like, you're expected to go to the doctor for them to tell you what to do, kind of
Right.
thing. And I actually have a problem with that. Especially, but
Okay.
that's, typical modern,
Yeah,
Western medicine, is like you're handing over your power to the
exactly.
professional, right?
Hmm.
But from my perspective, and what I really try to empower my clients, is that you know your body better than anybody else in this world.
Absolutely.
Specialists, I don't care how many years you went to school, how long you've been practicing. I know my body, you know your body better than anyone else in the world. And our intuition is so powerful, but we've been so conditioned to ignore it, right? That little
Yes.
small voice, that little like question, like, I wonder if da 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 da. Like, listen to that, listen to yourself, and take some time to like really tap into, like, what is it that you actually want from this experience? Because it looks different for
Yeah.
everyone. Some people
Yeah.
want a home birth. Some people, say right at the bat, I want a belly birth or a C-section. Like, I don't want to go through all that. Some people have
Yeah.
different medical situations where certain options aren't available to them, like a water birth. So there's so many
Hmm.
different ways that it can look like. So just knowing like who you are, what it is that you're wanting from the experience, and then finding providers that align with that, letting them
Exactly.
know what you want, and then making sure that they're in agreement, because they're not just like taking care of you and giving you the service. You're also like interviewing them, like you're hiring them, so
Yeah.
they
Yeah.
need to be on board. Like if you're hiring an employee for your business, or someone to come and clean your house or something, you're going to make sure that they're going to do the things that you want to do. So it's
Exactly.
it's the same thing with pregnancy and postpartum as well, and
So
just life, just
ladies,
health.
yeah. So ladies, that's a good thing to know. It's like when you do go to the doctor, and you find out that you're pregnant, you want to make sure that the person you're choosing is the one you want to go through this first journey with. Right?
Absolutely.
And knowing that you want to make sure that they give you the best possible care as you going through the process. Now, is it hard for doulas and providers to work together, or is it something that is basically seamless? Do they see it as two different things or no?
So it is two different things, as doulas don't provide any medical service. So we're not
Yeah,
doing, checks. We're not, doing any of that. It really is support. And there are, for the most part, a lot of providers are coming around and they're very receptive to doulas, especially because the research is showing how impactful having a doula be a part of your team is. Like the reduced rates of
absolutely.
unwanted interventions and C-section rates, all of those things are decreasing just by having this, support system, this support
Yeah.
person by your side. And so it's truly, truly, truly a great thing to have on your team.
Now, when I look at some of the, and again, I don't have any kids, so I'm just speaking on the outside, right? When I look at some of the Instagram videos and everything, and I see the doulas there and they doing like the home birth or whatever, I don't know if you saw them. It is the environment they set up. It is the peace they give. It
Absolutely.
is the women around them that just provide this environment where you know that your baby is being born in love. You know what I'm saying?
Yes.
Like
Yes.
that's what I get from it. Like it takes a village kind of thing, and the village is there for you to help you bring in this miracle, right? And this
Absolutely.
miracle that's coming is coming full of love. It's coming in an environment where everyone is calm and is happy. Versus, and not saying it's a bad thing, but versus being in the hospital where everything is so quick. You know, the doctor's here, this person's there. You know what I'm saying? And you have all this running around where you're just happy to get it over with, right? So when I look at that, I say, wow, what you guys do is important because it's like you said, that mental part that a woman has to go through is so important. So now
Yes.
that we talk about the physical, what is it that you do for the physical with the pelvic floor, you said? What
Yes,
do you
pelvic
do with
floor.
that? Mm-hmm.
Absolutely. So during pregnancy, again, so first I'll just start off with saying like physical therapy, people think, oh, I can only go to physical therapy like if something's wrong, like I broke a bone or I was in a car accident or, I'm in a whole lot of pain. And yeah, we're great with helping and dealing with that, but part of physical therapy is also with prevention and maintenance. And
Right.
so during pregnancy, a lot of times people do have pregnancy related discomforts and pains like back pain, hip pain,
Yeah.
sciatica, that pain going down your leg, that pubic pain, the round ligament pain. So like there's, because again, lots of transitions, things are stretching and moving. And so there can be, discomforts that you're experiencing. And so going into pelvic floor physical therapy, perfect for that. A lot of times people think, you might get on social media and people get in these groups and ask the questions, oh, I got this going on, who should I see? Everyone's quick to say massage therapist or
Yep.
chiropractor, and they're great
Yep.
too. Like
Mm-hmm.
the whole team, the whole village is great, but also pelvic floor physical therapy, because we are very specialized in dealing with that. Um, and also if you're not having any pains at all, just being able to help you prepare for the grand event that's coming of birth.
Yeah.
Again, regardless if you're going home birth, hospital birth, birth center, wherever, if you happen to birth baby in the car, wherever it happens to be, but the pelvic floor, if you think about it, is holding up everything. Okay, so
Yeah.
I don't have my model here with me, but if you think about, so the pelvis here, if you think about my hands as the
Yeah.
bones of the pelvis, your pelvic floor sits right on the bottom. Okay, so
Cool.
everything that's inside the pelvis, inside of your core, the pelvic floor, its job is to help support and hold that up. So even in our daily life, pregnant or not, pelvic floor is doing a lot of work all the time. Anytime it's part of your core. So we think of core as our abs. Yeah, you got your abs, you also got your back muscles, your pelvic floor, and your diaphragm, which is that muscle that helps us to breathe. That is
Mm-hmm.
part of our core. And so anytime you lift a finger, your core is being activated. Okay. And so it's having to do all of this work. Now we add in a 6 to 8 pound baby,
Jeez.
inside of there with increased fluids and a placenta and, all these other things. The pelvic floor is, again, doing a lot of work and it does a phenomenal job at it. Like it keeps us going. We just keep on trucking along. The body is amazing. But then a lot of times because of this increased stress, those muscles get tight, right? And so they kind of tense up because they're working kind of overtime, trying to hold everything
Yeah.
in. But if we think about, so the grand event of birth, we want a baby to be able to come through these pelvic floor muscles. We need those muscles to be able to release and relax.
Yes,
So a
ma'am.
lot
I
of
get it.
times with the patients that I'm seeing that are getting closer to birth, where that's what we're working on. Okay. So we're
Mhm.
not working on Kegels, get it strong, get it tight, and all that
Right.
jazz. That's cool, but every muscle needs to be able to tighten and release. And especially when
Yeah.
preparing for birth, you need to focus on that coordination and that breathing. Breathing is huge in being able to help release those muscles, release that tension, kind of pull yourself out of that stress response that our bodies naturally go in when things are happening, when there's pain, so that we can have a successful birth with minimal tearing of the pelvic floor muscles or the perineum and minimal pain.
Oh Lord. See, y'all, you got look. I I praise all of you who actually went through that. I do. It sounds like a lot of work. And so afterwards, is there a way to get back to normal, or do you help adjust to whatever the new normal is because you had a baby? And I just be thinking about those people that have like five, six kids. What's going on with the pelvis? And like that pelvis, like, damn, not again.
Listen, like I
And
said, the body is
twins,
amazing.
carrying twins and triplets.
Yeah,
I just be
yeah,
like, wow, wow.
yeah.
So after, do you help? Do you repair it, or do you live with the new normal of it, or how does that work?
Yeah, so again, the body is amazing. So it sounds like it's a lot. It sounds very traumatic, but our bodies are created to do this, right? It's very natural and normal. And the body does its thing. We're just here again just to help facilitate the process. But the body's gonna do what the
Yeah.
body's gonna do. The baby works together with the body with hormones and all that, and it does a great job. So after for postpartum, so we're not doing any, so the repair, if there is any repairs that are needed, that's being done in the delivery room, like by
Yeah,
the
definitely.
provider.
Mm-hmm.
When you come into pelvic floor physical therapy for postpartum, which you can start right away. Okay.
Mm-hmm.
So I do want to say with pelvic floor physical therapy, there's this notion that we're like laser focused on just the pelvic region and your pelvic floor. That's
Yeah.
given the name. But like I mentioned before, pelvic floor is part of our core, which is a large part of our body, and it's involved with every movement of that we do during the day. So we take a very holistic and whole body picture and look, especially postpartum, because everything changed.
Mm-hmm.
And yeah, we get messaging and it's like, oh, I want to get my body back. I want to get my body back. And I challenge a lot of things if you haven't gone yet. But I
Yeah.
challenge that because, like you said, yes, it is a new normal. You got a new body. Okay. So I
Yeah.
liken like pregnancy and postpartum, like, going into a cocoon and now you're a butterfly. Okay. We got this brand new body we're going to have to work with. It's beautiful. Um, but it's kind of like learning how to do all the things. And I kind of take it along the step-by-step process of like, well, first of all, you were probably given, 9 months to a year where things were different. Like if you were preparing for pregnancy, you probably changed up some lifestyle things about, a year ago. Now that
Mm-hmm.
we're postpartum, first thing that you can start to do for pelvic floor health is deep breathing. Like I said, deep breathing is really great in just normalizing the nervous system, helping the pelvic floor, and doing some gentle lifts and lowers with the pelvic floor. We're not getting crazy, right? The body's going through a lot of healing, and we want to support that process and give it time to heal and rest. And that is pelvic floor physical therapy. It's just if all you do is breathe and engage your core really gently, you've done pelvic floor physical therapy.
Wow.
If when we get a few weeks down the line and if we're having any issues with like leakage, incontinence, or if you've got like an urgency to go to the bathroom or constipation or pain or anything like that, then yes, pelvic floor physical therapy once again will do an assessment as to see like what is like the major thing that's going on right now, and how can we help to address that? We have a huge toolbox of different things we can do to help address the different things that might be going on depending on your unique situation.
Wow.
So like really getting you back into gentle movement, mobility, releasing any tension anywhere, strengthening your core. And that may not even include Kegels right away. Okay, so a lot of people
Right.
think pelvic PT, or I'm just gonna go do Kegels. What else are you gonna do for me? I
Right.
very rarely give people Kegels to do. Very rarely. It's usually, and if I do, it's not the first thing that I do. There's so much more that we do before we get to that point.
Wow. You are a true blessing. I'm just thinking about the whole process because I think, the provider stops at a point where it's just like, oh, here's your baby, wonderful. Okay, go home, come back. Let's check on the baby. Let's do everything we need for the baby, make sure the baby's healthy. And then they turn around and say, well, how you doing? Oh, I'm doing pretty good, good. Okay. Now the baby needs shots and the baby needs this, right? But
Yeah,
focusing on the mom so that she can get her body back in order, I'm just like, that is amazing.
yeah.
I think what you do is great. And just the
Thank
whole
you.
concept that you use as far as breathing, a simple technique that does
Mhm.
so much for the body is something that we probably need to be practicing every day already,
Yes,
right?
it is. Then most people that come in, again, whether or not they're pregnant, that's the first thing that we kind of focus on because most of us don't breathe properly, which is crazy to think about. It's like, well, I breathe all day
Right.
long. That's how I survive. But a lot of us are this like chest breathe, this stressful
Yeah.
breath, and not taking really full, deep, healthy, cleansing breaths. And it does wonders for the body, especially
Wow.
in this day and age where we're all stressed and, overstimulated.
Wow. Dr. Harris, how can we follow you? How can a person make an appointment or at least inquire about your services?
Yeah, sure. So my business is called Competent Heart, and you can find me on Facebook and Instagram at CH Perinatal. So I'm about to come out of maternity leave, so I will be doing virtual consults. So going through, I have like a system that I go through of all the different, functions and things that the pelvic floor does. I call it the P's and Q's of pelvic health because there's so many things that the pelvic health and wellness includes, and just different aspects of life. And so I really love just bringing awareness and teaching people how they can just tap into their own bodies and really, again, reclaiming back your power. So instead of giving it over to the physicians and waiting for, because we didn't talk about this, like you go to your 6-week checkup and they're like you said, "Oh, how you doing? Oh, I'm good. No complaints, no questions. Okay, bye."
Right.
What 6 weeks is a long time. And then a lot of providers still aren't referring to pelvic floor physical therapy, but that doesn't necessarily mean that it's not for you. It's just the knowledge and the information out there. A lot of providers just aren't used to referring out just yet, even though it should just be automatic. Like in France, I think you get 6 visits
Wow.
automatically right after you have a baby. Here in the US, we're still working
None.
on it.
Wow.
It's an interesting dynamic, but it's definitely needed, even at least one visit for an assessment to get the information that you're needing to start making moves and start healing your body, regardless of what stage life you're in, but especially postpartum. Every postpartum person, whether you had a baby at full term or not, like you need to be in pelvic floor physical therapy.
Dr. Harris, thank you so much for being here. And thank you so much
Thank you.
for sharing your knowledge and everything. Again, and I just think that what you're doing is amazing and how, you bring babies into the world surrounded by love and also help the mom heal after. We talk about it a lot about how, once you now have this baby in front of you, everything gets pushed to the baby, and you
Mhm.
always are pushing yourself last because this is where all the attention goes. But
Yeah,
if you're not taking care of yourself, how are you going to take care of this little thing that you have,
exactly.
right?
Exactly.
And
Yeah.
and health, you would know, health is one of the biggest things that you need in order to be able to keep up, in order to be able to, help this little healthy thing grow that you love so
Right.
much, right?
Absolutely. Yep. and for you to be present and be the best parent that you know that you can be and that you want to be, for sure. And then just even that, because therapy session, PT sessions are usually about an hour long. That's a little hour of
Mhm.
self-care for you, where you're just taking care of
Absolutely.
you, focusing on yourself so that you're not in pain, so you can get down on the floor and be with your
Hmm.
babies, and move around and do the things that you want to do. So, you said it's like self-care. Self-care is not selfish,
It is. Yeah, it is self-care. And like I tell people, self-care is not only getting your nails done and getting
Yes,
your toes done and getting a massage. It's about making sure that you stay healthy, that you eat well, that you're breathing, that you're doing the things in order to get your whole entire body in sync. So,
right.
yes, please give us your social media handles one more time before we go.
Yes, it's at CH perinatal. So CHPERINATAL. And that's on Facebook and Instagram.
Dr. Harris, thank you so much for being here, and you have a good
You're
night, okay?
welcome. Thank you. You too.
All right. Bye.
Bye bye.